Hello and welcome back to the Nurse Rosa's Insights podcast, where we amplify the voices shaping the future of healthcare. My guest today lives by a phrase that will change the way you think about health. You can't change your genes, but you can change your environment. Dr. Manish Arora is an environmental epidemiologist and exposure biologist, the CEO of Linus Bio, and a professor and vice chairman of environmental medicine at the Icahn School of Medicine at Mount Sinai, where he leads a team of more than 50 scientists studying diseases we talk about at the bedside every day, everything from autism to ALS to cancer. His groundbreaking work uses something as ordinary as a baby tooth or a strand of hair to reconstruct a person's chemical exposures all the way back to the womb. And that technology earned an FDA Breakthrough Designation for an autism biomarker that can be tested for as young as 1 month old. He's a recipient of the Presidential Early Career Award for Scientists and Engineers, the author of Environmental Biodynamics, and a scientist who's rewriting how we understand the conversation between our bodies and our environment. Lean in, because this episode might change how you think about every patient's story, including your own. Dr. Manish Arora, thank you for joining me today.
Rosa, thank you so much for having me on your show. It's a real pleasure.
And I appreciate your patience with me, as before we started, I had to confirm how to pronounce your name. And that led to us going back in time to how your name came about. Would you mind to share that story with our listeners?
Absolutely. And it's a very interesting story. I was born in a remote part of India. My father was an engineer on a hydroelectric dam, and like most dams, they're not built in the middle of any city. So this was a remote part of India where everything took a long time to happen. And I'm saying that because my parents actually never officially named me until I was about 3.5. So
That is amazing to hear.
when time came to travel overseas, they needed a passport, realized you never officially named this kid. So they
Oops.
were talking about naming me. Apparently, I was in the room and I put my hand up and said, well, I like to be called Manish because the neighborhood kid who used to babysit me, his name was Manish. So I actually ended
Aw.
up naming myself.
How did do you know how he felt about you wanting his name?
No, I don't, but I don't want to have your listeners think that my parents were in any way negligent. They were actually very loving parents. I always say I won the lottery. I had the best parents that a person could have. It's just there's this quirk where in a busy multi-generation household with a lot of people running around, they just forgot to name this little co-head kid who always sat at the back and then wasn't very loud. But it's a nice story sometimes.
I mean, I thought it was really funny. And, we have a saying here in the South, because I'm over in Kentucky, and we say, you can call me whatever you want as long as you call me for supper.
Yeah, yes. And look, I've traveled to Kentucky, and I have to say it was one of the most welcoming, community that I've experienced. I'm a proud immigrant to the U.S. and very grateful for what this country has given me, especially now that we are 250 years old officially tomorrow.
Yeah, exactly. So we're recording this right as we are on the Independence Day weekend, and you guys have an exciting announcement coming up this week. So, but I want to go back into kind of your story of how you got into this line of work, because you've had a lot of different things that you've worked on in your career. So, what gap in healthcare did you see that led you to found Linus Bio? I'd like to hear about your transition from academia and research into applying that science in the real world.
Absolutely. There were two gaps. One was, still in the academic setting. And that was that if you look back at the past 20, 30 years, medicine, especially precision medicine, has been very gene centric. We sequenced the human genome and we started studying our genes, thinking that would explain everything. I'm not criticizing genomics. It's actually been very successful and helpful in certain areas, but it doesn't explain all of your health. So there's this other component, which is the environment. And we've been talking about this since the dawn of human civilization, nature versus nurture.
Mhm.
That was one aspect I felt like environmental medicine is this poor cousin of genomic centric medicine. I really want to have an impact. The second aspect of that was my own personal journey. I'm the proud father of triplet daughters. They're 13 now, so I've got three teenagers at home,
Oh my goodness.
and just the most wonderful journey. My youngest one by a minute is neurodiverse and was given this soft diagnosis of autism, which took me 2 years to figure out is actually the wrong diagnosis. She is not on the spectrum.
Oh, really?
And what we realized from that journey was that, look, academics are doing research here, and this is where the rest of the world is. The taxpayer is waiting for a solution. And there's this huge gap in between, this valley that very few academics are crossing. I learned this firsthand as a parent, because when we started to ask for a test for autism, we were given questionnaires. So it just surprised me, because I used to be a clinician in the oral surgical field,
Mhm.
where we prescribed lots of tests. I always asked for a path report before I touched anybody with a scalpel. I don't
Mm.
want anyone to bleed on my table or have uncontrolled diabetes or something like that. But here, when it came to diagnosing with autism, they were not prescribing any tests. We were filling out questionnaires, and my answers and my daughter's mother's answers wouldn't align.
Right? It's very anecdotal, isn't it?
Exactly. It's very observational, very subjective. And I said, well, why isn't there a blood test? Why isn't there something else? So
Mhm.
that's what really led me to not only developing an autism biomarker, but also a test that could help empower people to change their own environment. As you said, and I've said many times, you can't change your genes. And my daughter, we gave a blood sample from her, and they did a massive genomic screen. I came back home and I said, what do I do differently tomorrow? And there was nothing. So I wanted to give people something that they can change themselves. Always
Mhm.
like to say, you are the CEO of your own household. You can do a lot to improve the environment within your house.
And I think we need to clarify for our listeners, because you and I were talking about this earlier, that your neurodivergent daughter is not genetically identical to the other two sisters. So it's not like you could just compare her genes to theirs and say, oh, this is the one difference in their genome, right?
Exactly. So of the triplet daughters, two are identical, and my youngest one, who's neurodivergent, is not. Their mom is of Irish Australian descent, so
Mhm.
two look very much like her side of the family, and this one looks like my side of the family. So there's this very nice mix of all kinds of things. They're wonderful children. I love them. They've given me new purpose in life. But exactly, you couldn't
Mhm.
just say, well, it's this tiny genetic difference. The other thing I found was, if you ran a genomic screen on anyone, we're all walking around with these little quirks in our genome. We call them microdeletions. For the
Mhm.
most part, they don't do anything, but in some individuals, they do a lot. So
Mhm.
again, it leaves you with these often uncertain answers, where you can't wake up the next morning and say, okay, this is the solution, I will do something differently. And so one thing that I want to change and lead by example in academia is to encourage more academics to take their research but then package it into a solution. Because I always say the ultimate arbiter of our success as scientists is not the awards we get or the grants or the books we publish. It's actually the taxpayer. If we haven't helped taxpayer like me as a parent, then I
Mhm.
think we are falling short of the promise that we make as scientists when we take taxpayer dollars to do our research, that we will find a solution now, not 20 years from.
Yeah, definitely. Now, for the clinicians who are listening, can you explain how the technology works that we're talking about? How would you describe the difference between the episomic data and the standard blood panel that most patients are used to?
Absolutely. So the first of all, the exposome, because it's an uncommon term, is the complement to the genome. Think of it like this: it's the totality of environmental exposures and how our body responds to those exposures. It's not just the environment outside. It's not just the pesticides or the lead you got exposed to, but also how our body reacts to it, but over time. And the technology we developed really attacks this one big problem that for a long time the whole scientific community was struggling to overcome. And that was this. You know, Nurse Rosa, I could measure your genes the day you were born or today, and I'd get the same answer, because your base genomic sequence is static. Your genes are your genes. Sure, there are minor epigenetic changes, but for the most part, your genes are your genes. But the exposome changes all the time at an hourly, you know, interval. I'll
Mm,
give you a simple example. If you woke up at 7 in the morning and had a double shot of espresso versus 7 p.m. in the evening, same exposure, same genes, your genes haven't changed in a day, but your body reacts so differently. So your
mm,
exposome is very sensitive to time. How do I get something like 500 blood tests done every hour, but do it at scale? As a nurse, you know that that's not e- that's not going to happen. It's not safe. And doing it every hour over 500, 600 times means you haven't slept for a whole month. So
mhm.
this is just not possible. So we developed a technology that just takes a single strand of human hair, analyzes them along the growth rings, and from a centimeter of hair, we get about a month of information, and that's about 600 different time points. So that's the technology. We are finally able to go back in time and study your molecular patterns at an hourly resolution.
That is incredible. And the thing is, I think most of people, or at least I have only really heard of hair tests being used either for DNA or for testing for drug contents like marijuana to see if you've had any in your system in the last 3 months. But in this case, walk us through what traced actually measures for and how the science behind that hair based exposure works.
Yeah, and yes, you're absolutely right. Traced is the name of a new test that we have developed. It in its first release, it measures 15 different elements. These include the essential stuff like the zinc and copper, the nutrients that keep us healthy. But it also includes some of the toxic exposures that we still experience, like lead or aluminum or cadmium. These elements can be very bad for your brain, but pretty much every system in the body. The difference between what we do and what the older technologies, like the one you mentioned for testing for drugs, do are twofold. Those older technologies often collected like 100 strands of hair, mixed them up and gave you one number. So yes or no, yes, we detected marijuana or another drug, or we did not. There was no time Here, what we do is when we get a centimeter of hair, we give you a whole month of profile. So we say, hey, and we've seen these patterns, that every 5 or 6 days on the weekends, you have a different exposure profile. Something is going up. So you're doing something on the weekend that is
Hmm.
different to what you're doing on weekdays. And that allows us to figure out what are the sources of exposure. What we also do is that after we have analyzed the hair, we look at patterns. We have developed our own AI models that have been trained on reliable data from the CDC, the NIH, the EPA, and we give exposure guidance. Like I said before, I really wanted to empower the clients who use this test and say, if you make these lifestyle changes, we think, some of these elements are probably coming through your water supply. So let's think about a reverse osmosis filter. Or
Hmm.
maybe this is what we see usually coming in dust. Are you dragging outdoor dust, traffic dust, pollution into the house? Things like that. And at the end of the day, what we decided as a group of scientists and as a company was that we do not want to route this changes in practice, the improvement of your household environment through a very complex medical system. People should be able to do it themselves.
Right.
We wanted them to be able to just go on a delivery site like Amazon and buy the solution for just a few $100s and be able to have that positive change by themselves.
And not have to wait months for approval through insurance, etc.
And we know, look, the healthcare system is already overburdened. There are long wait lists. Going back to the autism example, wait lists for autism testing in some hospitals are over a year.
Yeah.
So again, the solution should not just be developed, it should be accessible, it should be affordable. So I have a team of very bright, business minds, people who understand what the community needs. And together we said, let's make this really accessible and actionable. And I always told them perhaps the most specialized skill you would need is plumbing, and that's to inform install the reverse osmosis filter. And honestly, I did mine myself. If I can do it, anybody can.
Well, okay. All right. I guess you will have job security in the age of AI then if you can do some plumbing.
I don't think AI can displace plumbers. I'm sure of that. But honestly, these days those filters have become so easy to install. Anyone could
Mhm.
do.
Oh, nice. Now, let's talk some more about why hair specifically, because I think you mentioned like the barrier of collecting samples when it comes to blood. And then there's also like urine testing. But is it the specificity of the timing that you get with the hair strands that's really the key differentiator as far as what biological sample you're using? Or is
Uh,
there something else?
Absolutely. So remember that in your routine medical, assessments, your wellness test that you do once a year or once in 6 months, these are all snapshots. What you measure in blood is just telling you what you're experiencing just then. Same thing with urine tests, because they tend to forget, whereas hair has this timeline of your exposures and your body's response to those exposures. So that was very important. We didn't want to just look at the snapshot, because the snapshot doesn't tell you, well, every weekend you have this different pattern to the weekdays. You can't get that from what your doctor measures. I always go and as part of research, we also measure cholesterol in hair. So I was
Oh, and hair.
absolutely, and we do it routinely. And I was telling my doctor, whenever I ask you about cholesterol, you just say, "Oh, it's high or normal." But what if I ask you the question, what's the rhythm of my cholesterol? You don't have a way of answering that. We can, because I have 500 measurements over a month. And my argument, my hypothesis is that the rhythm of your cholesterol is likely just as important as the level. I'm a fan of Springsteen. I love Springsteen music, and no offense to Taylor Swift fan, but if I had a choice, I'd go listen to Springsteen. But I think that's just a generational thing. However, you know, appreciating a Springsteen song has got nothing to do about how high or low it is. It's everything about the pattern of the music, the rhythm of the music. The same way, understanding your cardiac health is not about how high or low your cholesterol is. The rhythm is also going to be important. Yet that simple fact is completely missed in medicine every day. So that is one aspect of hair that is so unique that it differentiates from blood and urine. And of course, collecting hair at home is painless. You just use some scissors. We're not asking you to pull hair. Just use some scissors and clip it. Uh, No freezing like urine, no messiness like a stool test, and no, chemicals for preservatives and stuff, no shipping on dry ice. It's perfectly fine at room temperature. I always tell our clients, if you spend more than 30 seconds doing the hair collection, you're overthinking it.
Yeah. And you mentioned lead and arsenic as some substances that we know are more toxic to our bodies. What are some other like clinical blind spots that you're looking to close with the traced tests?
Absolutely. So in its current version, and I'll talk about the future release as well, I said we are measuring these 15 elements. So we measure lead and arsenic and aluminum and several other exposures like barium and strontium and lithium. You'd be surprised how many people have background lithium exposure, mostly coming from the water. Arsenic exposure from various other aspects, contaminated food, house dust or traffic dust, and sometimes the water supply as well. None of this is measured by a clinician. In fact, none of this is measured at all. When I go for my wellness test, the only environmental factor that's really discussed is, do you smoke? And I don't, and that's the end of the story, right?
Or
But
they ask if you live in a building that was, built before 19 whatever,
before
before they
1980, in the
tested this out.
1980s, there might be some, but usually they just ask it when in a pediatric visit, or they used to ask for my children because the lead blood test is mandated around the age of 2, and so on.
Mm, yeah.
But if you really take a step back, Nurse Rosa, and ask yourself this question, and ask your audience can ask themselves, in your daily life, what are you monitoring around your house? And the answer is, well, I monitor the temperature through my thermostat, and every house must have at least a few fire alarms. So I'm monitoring that. But the hundreds of exposures that we experience around our house, we barely measure 2 or 3. Maybe you have a humidifier or dehumidifier, you're measuring household humidity, but really you aren't measuring your exposures. At present, we are measuring 15. The next version of trace, we'll add another 100 to it. And those 100 will be, we all talk about microplastics. So, what are the chemicals that leach in from plastic? We've heard of chemicals like phthalates, bisphenol A, and now it's replacement compound that are really bad for your system, bad for your endocrine system, bad for your fertility, and so on. We've talked about forever compounds, these PFAS or compounds that are used in flame retardants or those non-stick frying pans where I always tell people throw those out.
Yeah.
We all like sunny side up eggs, but I think we can live with scrambled eggs like I make now in my ceramic pan that it's more sticky. I'll admit it, it's way stickier and the eggs stick to it relative to my non-stick pan, but it's so much healthier. So we measure all of that. We also
Well,
measure yeah,
you
go.
can also put butter in there with your eggs if you wanna make some fried eggs.
Oh
It
yeah,
might not it might show up as a spike on your hair and your cholesterol, but
no, to be honest, but I'm a big believer. I like butter, so I'm glad you mentioned that, Nurse Rosa, because that's the only way I can make over easy eggs is a lot of butter,
That's right.
and there's a place for it. So what I wanted to do was empower people again by
Mhm.
information, but also actions that they can take themselves.
And Dr. Manish, you said Linus Bio's partnered with wildfire affected communities in like the Eaton and Palisades fires that happened recently. And so, what did that real world deployment teach you about how people use this kind of data?
Yeah, it's been a wonderful journey. I really want to thank the community of the Palisades and the Eaton fires because first of all, they've experienced something that is really, moving. Our homes mean so much to us. It's the most expensive thing most of us will buy, and our memories, our life is there. And to have those homes threatened by fires is such a major event. And they're real champions for what they're doing. They approached us because many months, almost a year had passed, and they were wondering what, now that they're returning to their homes that were still standing, but really impacted, contaminated by the fire. They were wondering, is this safe? Has what the insurance companies they've paid for, is that enough? So we did this, and I'll share one example, which became a feature article for the New York Times.
Mhm.
This one family that had been exposed to the fire and had moved out, their exposures in the hair were high to begin with, and then as they moved out and were staying in a motel, they came down. But now that insurance had said, okay, it's safe to go home, as they went back home, the exposures started tricking up again. And as the exposures tracked up, they decided to take a vacation and they left their home and they came down again. Then they
Oh,
went back home and started cleaning up the house. And as they cleaned up the house, it's natural to release dust as you're cleaning it up.
mhm,
They all spiked up again for the
mm,
whole. And so what we are helping the standing homes community around Palisades and the Eaton fire are giving them this profile of what they experienced in the past that they just cannot get from blood or urine because
mm.
all of that signature is forgotten in blood. So you could do a blood test now and there is no history of what happened to you during the fire and right afterwards. So we're going back in time using this sort of time machine to reconstruct the exposure. And we are saying, look, these are the high exposures you've had. Some of them have come down. Some of them are actually going back up now that you're moving back into these environments. That empowers them in two ways. One is it allows them to start looking at their household environmental health, how much more cleaning is needed. It also allows them to use this technology as an early screening or as an early sensor. If you're high in lead, by all means, you need to go to your clinician and say, what do I do next? And they'll most likely ask for a blood test, which is the standard clinical tool for lead exposure. And, and in this manner, this entire community has understood their exposures and are also now trying to negotiate with the insurance companies to do a better job. It's one of the proudest moments of my career that an assemblyman in California actually introduced a new law based on this technology, saying insurance companies must use technologies like this to decide when a house is safe enough to return, not these policies that they have internally, which are very opaque. We don't know how they decide, to be honest. It's a very, you know, bizarre process that they use where some of the standards they use are ones they develop themselves. So there has to be this healthier partnership between insurance companies and their clients. It's not like a usual product that you buy. This is meant to be used at a time of need. So when this Congress or Assemblyman introduced this bill, I was so proud. I felt like, okay, finally there is going to be a positive change.
And you're seeing the application of this research in the real world. And you and I were talking earlier about how there's this huge like adoption gap in the translation of research into practice. Like it could be 13 or 17 years after you make a discovery and publish about it before it actually works its way out into the real world and gets applied and changes lives. So I'm so excited for you to get to see your work making an impact in the real world, because I know a lot of researchers don't get to see that.
I'm very grateful to the American system. I don't believe there's another country, and I've lived in 5 countries. I don't believe there's another country on the planet that would have given me and my family these opportunities. That would have allowed this science, these ideas to be nurtured and even celebrated to this point. So, as like I said, we're going to celebrate our 250th birthday. I'm just very grateful to all the Americans that came before me that have created this amazing society with so much opportunity. One thing
Yeah.
I'll say to my academic colleagues is we often think we'll do the research, we'll publish it, and then there's this amorphous force out there that will take our research and create a product. The reality is that amorphous force doesn't really exist. You have to do it yourself. You owe it to the taxpayers to take that leap and say, no, I'm going to create something that someone can buy in a box, you know, and I'm going to make it real cheap, real affordable, real accessible, and that's something that I have learned, and I'm very grateful that I got to take this journey from pure academic science and then starting this company, and now this company is grown to and to a good size and is having the impact that I always wanted it to have.
Yeah. So for you, starting as a researcher and a clinician, did you participate in like an accelerator or something that taught you how to turn this into a business?
To some degree, yes, Mount Sinai has been a very nurturing and wonderful employer, and they have this office that gives you some basic training.
Oh,
Uh,
great.
But however, this is one of those things that you learn on the job, right?
Yeah.
It's like you go out there, you set up this thing and you start working. You surround yourself by very smart people. This might sound like a strange thing for a lifelong scientist to say, but the science is the easy part. Converting that science into a useful product, the commercialization of science, is actually a lot harder. So, one of the first things I did was I surrounded myself with really smart business people who had worked with academics before, who knew that I know a lot about science, but I know very little about the real world of how people use that science. So
Mhm.
that's what I would encourage all academics who are listening to this. As you come out of the academic sector into the private sector, surround yourself by people who know a lot about the business of science, not just the science of science. I've developed skills that I never thought I would have.
Yeah. And like plumbing
Yes, yes.
and putting in your
It has caused a few leaks. I'll be honest here that when I get in there, things never work to plan. But look, if you can assemble a piece of IKEA furniture, trust me, you can do everything that we recommend in our report. In fact, a lot easier than I have also never successfully assembled an entire IKEA piece. But I'm always left over with spare parts. I don't know what they do. The tables are still standing, so I guess they're not essential. But if you can do that, you can do everything in our report.
Well, another thing we say in Kentucky is better too much than too little. So now back to when people are looking at their traced results, and if it's not as simple as getting a reverse osmosis filter, maybe they do need like a lead test or something else. For nurses and other clinicians who might end up fielding questions from patients who've done the test, what should they know about how to interpret and talk through the results with a patient?
Absolutely. So this is not a diagnostic test, and I just want to be very clear. So if you go to our website, trace.life, and you're interested in just all the information is there. This is, think of it like an environmental exposure test, an early screen. So for example, if we find high levels of lead, it doesn't necessarily mean that you have high lead exposure now because we're going back in time.
Mm.
As clinicians see this report, their first reaction will be, okay, there's an early concern. What do we do next? Now is the time for a blood test or some other investigation. So clinicians should look at this as a marker of early concern and then start doing further investigations. And I like that. I like that we are operating in this wellness area where it's very accessible and we can help bring down these exposures ourselves. Like I said before, the medical system is big and complex and it's already overburdened in most countries. So not
Mhm.
everything can be routed through this medical system, especially when we ourselves can affect a lot of positive change rather than relying on some prescription that then you have to wait for in a wait list to see your doctor.
And how do you see it impacting things like remote care and longevity and virtual wellness programs that clinicians are building a lot of those now?
For me, longevity and this move towards health span, not just living longer, but living longer healthier.
Hmm.
And I believe this is a core part of that movement. Every study shows that the environmental aspects are so much more important than just your genes in keeping you healthy for longer. We hear about these places called blue zones where
Hmm.
there's a high proportion of people living healthy till 100. There's been no gene identified for any blue zone that is common. We have some in the US, some in Japan, but in all of them we find shared environmental factors like clean food. The number of steps between farm to table is very few, so people are not consuming ultra processed foods. They're also living in communities where there's a strong social network. So these things keep rising to the top. But if you compare the genomics amongst all of them versus others, we find no difference between people who will pass in their 70s versus people who are living to 100. And so that again reinforces that environment is very important. Plus, environment is modifiable. We can make these changes. We can change it towards a positive impact. Trace is designed for telehealth and for these longevity and health span practices. Why? Because you can collect it yourself at home. We are helping communities in Mississippi through our partnership with the University of Mississippi, and many of them live hours away from the nearest clinic. So to get a blood test from them is an enormous effort. This you can collect at home. You can just ship it back in a prepaid envelope that we provide. So you don't even have to leave your house to go to the post office. You know, the courier service will come and pick it up. And all of this a clinician can interpret because the report is written in a very accessible manner. Again, and that is by design.
Yeah, and to your point, it's not replacing diagnostic testing, but it's kind of like a pre-screening. For example, if you see in it that someone's having dangerous spikes of one substance or something else they should have is really low, then they
Yes.
might know, oh, this might be worth driving in to get a blood test for.
Exactly. And when to do that blood test. As I mentioned before, if you're only
Oh,
spiking on the weekends and you're doing something then, the half-life, how long some chemical stays in blood can be very short. For example, if you were to measure tobacco smoke exposure, we use this metabolite of nicotine called cotinine in blood. Its half-life is just a few hours. So if you only get exposed on the weekends and then you go on a Thursday or a Friday to get that test done, your levels might have dropped so much that they are no longer clearly detectable, clearly visible to the clinician. So we're really trying to bring the time dimension into wellness and healthcare. And again, you said it very well. This is a screener, not a diagnostic tool. It's sort of a gateway into when do you need to rely on your healthcare provider.
yeah, exactly. And this brings me to the $1 billion question that I ask every guest on the Nurse Rosa's Insights podcast. So, Dr. Manish, if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
I'll give you two answers or two applications for that $1 billion. And I'll tell you why the maths will make sense in a moment.
Okay.
So at Linus Bio, we have two things we have developed: an early stage autism screening test called ClearStrand ASD. And it's the only technology in the world that can be used to rule out autism as early as 1 month of age. That's what you mentioned as a FDA breakthrough designation when you introduced me. I would roll that out to every newborn baby. As a nurse, you know that when babies are born, we do a little prick on their heels of their feet, take a drop of blood on this thing that looks like filter paper, what we call neonatal dry blood spots, and we screen for several genetic disorders. That only covers about 1 to 2% of conditions. We're not screening for these condition that we are so concerned about, like autism or ADHD and so on. So I would screen everybody. But here's the surprising thing. For conditions like autism, because therapy delivered early has such a beneficial impact, and currently we detect autism at the age of 4 or 5, so it's a
Yeah.
bit late. We did an economic analysis, and we found out that if we were to screen every newborn baby, instead of costing the government $1 billion, would save the government money in the long term, because now children who are on the spectrum would have lower severity. So that results in savings for healthcare dollars. So that's why I haven't used your billion yet. I've actually saved you $1 billion.
Okay. It's all
And
good to start
and
with savings.
yeah, and then the $1 billion that you're giving me plus the $1 billion that I have saved, now I have $2 billion. What I would do with that too is I would screen everyone using the environmental exposure test. So that everyone has a sense of, okay, this is my exposure profile. And I would do it every few months, every 3 to 6 months. So that's where I would use the money. Early screening for mental health, like autism, so we can start delivering therapy earlier than ever before, and a comprehensive profile of everybody's exposome. What are you getting exposed to around the house? How can we move that towards a healthier environment? And that would be how I would use the money that you're giving me.
That is awesome. And I am excited to see where it goes from here because what gets measured matters in that it gets addressed and taken care of. So thank you for bringing new things that we can measure and recognize so we can live a healthier life. I'm really excited about this. So for people who want to learn more about Linus Bio and the traced test, where can they find that?
For the trace test, please go to traced.life, not trace.com, trace.life,
Is
and
that LIVE or LIF?
fee,
Okay.
so life, and all the information is there. You can order it through the website, and the results will be given to you within 15 days. And all we ask for is just a couple of strands of hair that you cut with some scissors at home. One of the easiest things you'll ever do.
A couple you can spare. That'll be nice.
Yeah, me, it will take me a little longer to grow that 1 centimeter.
Oh, I didn't mean that as a
No, no,
personal
that's okay. But
comment.
I've got a little bit of fuzz at the back, so even I can do that. But it just takes me a few weeks to grow it.
Okay.
But I think for most other people, just on all we need is a centimeter, so we don't need a very long strand either.
Awesome. And then if people want to reach out to you, like, I don't know, other researchers who are like, okay, bro, how did you actually make this out a business out of your
Yes.
research?
Yeah.
Should they reach out to you on LinkedIn or what would you prefer?
Absolutely. I'm on LinkedIn, or you can see my Linus Bio email or my Mount Sinai email. It's all on the web. Please reach out. If you're a fellow academic scientist like me, I would be delighted to guide you and share my journey. And I hope you will make that transition too, from academic science to developing something that delivers an impact.
That is so fantastic. And I really appreciate you sharing it with our listeners here. So, for my listeners, if you've enjoyed this episode of the Nurse Rosa's Insights podcast, please be sure to like and subscribe wherever you're listening. If you'd like to connect with me, I'm also on LinkedIn, or you can find me on your favorite social media at Nurse Rosa Speaks. And then I will see you in the next episode.
Thank you for having me on your show, Nurse Rosa. It was a real pleasure.